before we get into our research break. So welcome everybody. Thank you for joining us this afternoon for our research break, which is called The Power of Aging Across the Lifespan. So I would just like to begin with a land acknowledgement. So the Schlegel-UW Research Institute for Aging acknowledges that we are on the traditional territory of the Attawandaron, Anishinaabe, and Haudenosaunee peoples. The RIA is situated on the Haldeman Tract, the land promised to the Six Nations that includes 6 miles on either side of the Grand River. So my name is Kyla English-Lease. I'm a project officer at the Schlegel-UW Research Institute for Aging. And today I'm delighted to welcome Dr. Kate Dupuis. Kate is the Schlegel Innovation Leader in Arts and Aging at the RIA and the Sheridan Center for Elder Research at Sheridan College. And I'm sure she'll introduce herself in a minute. She leads many studies on how participation in the arts can benefit all domains of health and well-being for older adults and those who care for them. So we're excited to have Kate join us today. We'll have about a 20-minute presentation followed by 10 minutes for questions. If you would like to enable subtitles today, you can click on the closed captioning or the CC button at the bottom of your screen. And if you are having any technical issues today, we will be recording this webinar, so you know, and we'll be sending out a link probably early next week, which will be on our website, so you can rewatch it then. You will notice at the bottom of your screens that you can access the chat function as well as the Q&A. You're more than welcome to use the chat throughout the presentation if you want to provide comments, but we encourage you to use the Q&A function for any questions that you have throughout the presentation, and my colleague Ali will be working in the background to compile your questions, and then at the end we'll go through them and make sure that we answer as many as we can. So now I would like once again to welcome Kate, and I'll turn it over to you, Kate.
Thank you so much, Kyla, and thanks to everyone who's here today to join us. So today we'll be speaking about the work that I do within my role at the RIA, as well as a lot of the work that I do is within the operation of Schlegel Villages. And I am currently located in Toronto, but I am a professor and a member of the Sheridan Center for Elder Research at Sheridan College in Oakville. So today we'll be discussing arts engagement and why I believe that we can see it in the context of healthy aging as a health promotion strategy. We'll really focus in today, we'll focus that spotlight in on music as the particular art form we'll be discussing. We'll talk about music in particular in communal care settings, such as retirement homes and long-term care. And we'll also share a little sneak peek of some of the work that we've recently been funded to begin within the sector. And I just wanted to take a moment to acknowledge the funders that have supported a lot of the work that I'll be discussing with you today, because of course, without funding for a lot of our research, we probably wouldn't be having the opportunity to share many of the wonderful things that we've been doing. So I am a clinical neuropsychologist, and when I used to work clinically, and even now when I provide intervention to older adults in the community, one of the biggest questions that people tend to ask is, how can I prevent myself from getting dementia? How can I make sure that my brain stays healthy as I age? And the key thing to remember is there's no sort of magic pill that we can take as we're getting older, but there are some very, very practical things we can do that are backed up by a lot of evidence that suggest to us that they'll help us stay healthy as we age. Things like getting enough sleep, moving our bodies, making sure we're eating well and we're hydrating, reducing stress if we can within our lives. And another really important opportunity for us to stay healthy across the lifespan is to engage in recreation and leisure activities. Now, you may think that these are just things that you can do, in a program or with an organization, but these may be things like reading at home or having a coffee date with a friend or walking in your neighborhood. So recreation and leisure activities can also be key components of healthy aging. And one particular subset of recreation and leisure activities that I think are so important, and the research suggests are so important, is the opportunity to participate and engage in the arts. And what we're really starting to find over approximately now 30 years of literature is that participating in the arts is an incredible way for us to stay cognitively, physically, emotionally, socially, and spiritually healthy as we age. And arts can be engaged in a variety of different ways right across the lifespan. And when we think about participating in the arts across the lifespan, for myself, my job title is the Innovation Leader in Arts and Aging, but I sometimes encounter some barriers when I'm speaking to folks about the arts. Some people may have preconceived notions about what the arts are or who can participate in the arts or what being good at art looks like. And so some research that we're doing right now with a social psychologist at the University of Toronto is really looking at this understanding of our own ability to engage in the arts. We're calling it artism. So this idea of trying to break down potential stigma and barriers to engage in the arts and to help individuals understand that right across the lifespan, you have an inherent capacity to be artistic and to engage in artful activities. Now, one of the things that does help in my work when I speak to individuals is we don't necessarily always use that term arts because sometimes it does have some connotations that can come with it. What I've noticed in some of my research is we did a study with about 120 residents of one of our retirement homes in Hamilton. And we asked people, what are you good at? What would people say you're good at? And a lot of the responses when we looked through and coded them were activities that one would say are expressive, innovative, creative. They may not be artistic activities, but they showcase that really personalized ability to be creative in everyday life. So things like woodworking, quilting, preserving, canning, a lot of activities that older individuals do that really showcase the inherent creativity in all of us. And of course, the most important thing when we consider arts participation across the lifespan as a key feature of healthy aging is the participation in the arts or creativity that you do, it must have meaning and purpose. I've been asked so many times, if I do crosswords, will that help my brain as I age? And my answer is always, do you like doing crosswords? Because if you don't, and you're sitting at your crossword, sort of muttering to yourself angrily, it's not going to help you. So the activities that we engage in must be activities that individually give us that meaning and purpose and that really, harness our desires to be able to be creative and to express ourselves in a new and different way. We know now from decades in the research that there are benefits of arts participation right across all the multitude domains of well-being. Many individuals, of course, during the COVID-19 pandemic have been experiencing restrictions on their social activities. We know that arts participation can be so incredibly powerful for example, our social connections. I have witnessed this myself, both in person and observing online programming, that power to connect, to share, to showcase what you're doing with another person, to receive and also to provide feedback. You can really see how, for example, painting or creating a puppet, creating a small theater production, all of these types of arts opportunities can help us across a variety of domains of well-being. They can have primary benefits. So if we're the ones engaging in the arts, they may be benefiting us. But they can also have secondary benefits for others. So in the context of a lot of my work, I interact with care partners, family, friends, staff, leadership within organizations, community members. And what you can find is even though some of the work is meant to provide arts programming for certain individuals, those in their orbit are also deriving benefits from their participation. So I think to myself of one of my kids who loves pandas, when he's drawing a panda and he's really hard at work doing that, I myself am not the one engaging in that art form, but I can see that he's enjoying it. I have pride in him. I can appreciate the joy he's expressing. And then together we can look at the artwork and discuss it. So you can see not only is he engaging in the art and deriving benefits, there's also secondary benefits for me as a care partner. And so for someone who specializes in the care of older adults and individuals living with dementia, I really do in a lot of my work focus on not only how are arts opportunities engaging and benefiting, for example, residents of our long-term care homes, but how can it have a wider spread ripple effect for other individuals in their orbit? And today I'm going to really be focusing on music. That's the particular art form that I'll be discussing today. And the studies that we talk about really focus on music and music therapy within the context of communal care. Music, and this is not something I think is new to anyone, music is an incredibly powerful art form when it comes to connecting us with others. Even before we had written language, we would sing to one another. There are many communities within Canada that continue to share stories and share learnings across the generations through songs passed down over and over again from generation to generation. Music can provide us with key social interactions, which many of us have perhaps had a diminished amount of over the past 3 years. Music can also be very useful for learning, for sharing. I went to a fascinating talk by a researcher at McMaster called Laurel Trainer, who looks at how young infants understand and process music. And her hypothesis was that music is so powerful for us as people because rhythm is one of the earliest things we ever learned and shared with other people. So when we were in utero, we were listening to our own heartbeat, our mom's heartbeat. We were learning about walking. We were feeling her walking movements. And so we've learned rhythm from the very, very earliest stages of our consciousness. And music and rhythm is also how we share information. You may think back to your own childhood or perhaps raising your own children or working with a friend and seeing them raising their child. Music is often a way that we share knowledge. You know, we teach kids numbers. My daughter is really into do, re, mi from The Sound of Music right now. So that's learning and sharing about musical notes and also about the ABCs. So music across the lifespan is incredibly powerful in a number of different ways. And the beautiful thing about music, because it's such a pervasive art form, you don't necessarily need to be in that one space to enjoy it. You can engage with music actively. So you may be playing an instrument, you may be singing in a chorus, you may be enjoying, a bedtime routine that has a lullaby in it, or you may be having more passive opportunities. Perhaps you've gone to the symphony, perhaps you're listening to music in the car, perhaps you're walking by a restaurant and you can hear the beautiful music coming outside. So music is something that is incredibly powerful, and not only if we engage in it more actively, but also in a passive way as well. We know that music can benefit our physical domain of well-being. For example, it can help us with our sleep, regulating heart rate. It can be very cognitively stimulating to engage in musical interaction. So for example, if you're having to follow along in a choir, you have to use your memory, you have to use attention, you have to make sure you've got good speed of processing so you keep up. It can help us socially to engage with others. It can help us emotionally. If you've had a really hard day, you may have a playlist that you love to listen to that helps to boost you up. And also from a spiritual domain, we're starting to see that not only is music, of course, involved within many religious faith-based systems, but music, for example, within a meditation context can be extremely powerful in terms of regulating our well-being. And when we're thinking about music sort of at the later stages of the lifespan, for individuals who may be living with dementia, music is also an incredibly powerful way for us to communicate when verbal and spoken language may become more difficult. So I'm sure you've all seen beautiful videos. You'll often see these going around on social media of individuals who may no longer be able to speak, but they can still dance to music, or a favorite song will come on and they're able to sing along. I've seen that in my own work in some of the villages as well. So when we think about individuals living with dementia, music may help us really, really well to communicate with them. So some of the work that we do within the RIA is looking at community-based music. So for example, working with organizations that provide concerts. But today I'll be speaking about 2 studies that we've done within the long-term care context. And the reason why we think it's so important to look at music within this context of a collective care setting like a retirement or a long-term care home is because music is very commonly offered within these spaces. So in some of my early work in my role, I had a research assistant sit down and look through hours and hours of activities that are being provided within Schlegel villages. And we found that approximately 1/5 of the activities could be coded as what we would say arts-based. And of that small number, the vast majority of them were related to music. And so music is just naturally happening within our homes. It's being offered within our homes, probably because staff enjoy music. It's a very accessible art form. You don't need a lot of supplies. You don't get messy. You can simply have a Bluetooth speaker and a cell phone. It offers opportunities with residents for reminiscence and, of course, that key social connection that is so important right across the lifespan. The work that I do within the long-term care space, I'm extremely lucky working within the Schlegel villages. Our team members have incredible ideas. So the two studies that I'm going to be sharing with you today were opportunities for residents that were actually developed by our frontline staff, our team members, and they were specifically responding to needs of residents and care partners. And the important piece about this is that when a researcher comes in with an intervention and says, hello, I'm going to provide you with music for a few weeks and then leaves, there's not necessarily as much sustainability in that type of model. So in these two studies I'm going to be sharing with you, it was actually the team members themselves who said, we really need to respond to the needs of our residents. Can you come and provide some support for programming we're going to be doing? And I will show you at the end of the talk how we're hoping to share these types of programs with other homes and other operators within Ontario, or really the sky's the limit. So I was on Facebook one day, 5 years ago now, it's hard to believe, and I came across this posting from our village in Guelph. It said, we're looking for children to join the Intergenerational Jamboree at Riverside Glen. And I thought, I don't know what that is. Sounds like something maybe that's up my alley. Jamboree sounds like music. I'm the arts person. I'm going to get in touch with them. And I did, and I found out that the village of Riverside Glen, through the director of recreation and the music therapist, was offering 8 weeks of music classes for young children and their parents, or perhaps a grandparent or other adults that would accompany them, and integrating that within a very common space within their home and inviting residents to attend. And so you can see here, we actually had a photographer from the Guelph today come out, and you can see here we have people assembled in a beautiful sunny space. I've circled some people in red because earlier when I mentioned those secondary benefits, you can see, of course, there's probably going to be benefits for the babies, for the parents who are sitting on the multicolored carpet, for the residents who are gathered closely around. But we also see our music therapist here, point of care staff, our recreation therapist. This here was a student from the University of Waterloo. We can see other residents gathered around, as well as individuals who are not necessarily providing care at the moment to these residents, but are themselves integrated into the care team at the village. And so what we did is we observed and evaluated 2 iterations of this program and had just received funding to do more when the pandemic hit. And we were able, luckily, with the support of our funder, to move this into a virtual format, which was a little comical, to be fair, with all these babies appearing on the screen, but we found our way through. And we were able to evaluate these programs. So we've now done multiple iterations of them at different villages in Guelph and Waterloo, online, in person. And what we see is very clear benefits for this type of music therapy opportunity. There's special relationships that develop over the weeks. At first, perhaps the children are shy, they don't want to come up to the screen, but then over time they get to know their, what we call their grand friends. The adults with them rate the enjoyment of the program very high. In particular, during the COVID-19 pandemic, a lot of the adults attending were moms who were on their parental leave and were themselves very socially isolated. So this was a really important opportunity for them to connect. We see that residents seem calmer, they're very engaged, they're laughing, smiling, moving to the music. And not only for the individuals directly involved in the program, but for all of the folks who are within that neighborhood, that unit of the long-term care home, there's this sense of anticipation and excitement. They know what's happening. Whether the folks are arriving in person or on the screen, they know what's coming, and it's very exciting for them. So I'm just going to show a brief video clip. You may need to adjust your sound. We've tried to not make it too loud. You may need to adjust. But you see here some of our residents on the Zoom screen, and then we'll see 4 children appearing for this particular clip.
Oh, what a beautiful morning. Oh, what a beautiful day. You like the picture? I've got a wonderful feeling. Everything's going my way.
So you can see here the children actually have the exact same items that the residents have at the village. We created music kits and they were hand delivered to each of the families. And that also helps with engagement because there's a recognition on the part of the babies and the kids and the residents. Oh, they also have the same shakers as me, or the same drums that I do, or the same types of scarves that I do. So it also helps to make that connection. Even though it's through the screen, it is helpful to cement that relationship. We also have engaged in what we call our virtual music therapy visits. So what we had noticed is that during the pandemic, when there was a lot of restrictions in terms of entry into the homes, team members would try to provide virtual visits to residents so that they could have a Zoom or FaceTime opportunity to connect with their loved one. But for many residents, especially those living with dementia, this can be very difficult. There's not a lot of perhaps language ability remaining, so interacting with a loved one can be difficult. They may not be as comfortable with the screen. And so the suggestion from the point of care staff was to not only just have a static conversation for these visits, but to integrate music therapy. Music therapy is a safe place to meet, and it can just help the experience to feel a bit more familiar. And so what we did is we would have our residents and 1 or 2 family members connect virtually through the screen. The music therapist would be there to facilitate conversation, discussion, reminiscence. We had a wide variety of people participate. We had great grandkids, people from across the country. We had a dog show up in one of our sessions. And what you find is that the residents themselves were participating in these sessions. Perhaps they were participating at their own ability level. Perhaps it was a bit more active or more passive, depending on the resident, but they were singing, moving, tapping, perhaps simply nodding in response to questions, sharing stories, accessing memories. And the music therapist said, she could see this sort of brain waking up. The familiar music was being sung, those old stories that have been revisited so many times in the family were being shared again in this new context. And it was just an incredible way for people to connect with one another. The care partners, 100% of them said they loved the experience. A vast majority said this helped them connect with their loved one. There was reminiscence, sharing of stories. Individuals living with dementia are on a journey and their care partners are accompanying them. And so part of that journey is working through a grief over the changes to the individual. And for some of the care partners, that's what the music therapist, a trained therapist, was able to facilitate. And there were also contributions to the mental health of the care partners, which is so important for us because it is a village, what we do. It's not simply care solely for those residents, but for everyone who surrounds them. So we saw the care partners saying things like, we're 4 hours away. So this program helped bridge the distance between us. I believe in this program. It's proven its worth. One adult child said, I was trying to go in every single day. I almost had a breakdown. I had to stop. So this gave them that connection, but they didn't have to be so present. When there was emotional difficulties, the music therapist was there to provide that safe space, to provide that assistance. And it's also sometimes easier to have a trio than a dyad. So if one person is sort of dropping the conversation, there's another person to pick it up. So we really found such clear benefits for everyone involved in this program. And you can see here, our last session was on December 23rd. And so everyone dressed up, sang some Christmas songs together. This particular family celebrates Christmas. And we're really able to share that joy and connection, although it is over the screen, still able to have that opportunity to connect with one another. And thanks to our generous funders and to the support of the RIA, we've actually created implementation guides for both of these programs so that anyone, these are open source, available for free on the RIA website, anyone who wants can download these and learn how to implement these types of programs into their own context. Perhaps it's a retirement or long-term care home. We also have tips and tricks about, what to do, how to move to Zoom or back in person. So anyone who wants is welcome to go to the RIA website and look at these 2 guides. And so what comes next? We've been extremely lucky. We've received 3 years of funding from NSERC and the Canada Council for the Arts. So we will now be working with community partners, including Concerts in Care, Lucid, Schlegel Villages, and the RIA, to start to look at how we can use music, not only for the residents, but also for our team members. So to look at the staff experiences during COVID-19, we know how devastating the pandemic has been on the long-term care industry. And we believe that the power of music can be used to try and alleviate some of the distress and the injury that many of the team members are feeling. And of course, we'll also be providing musical opportunities for our residents to help them engage, to help them connect and reminisce and engage with others through the beautiful power of music. So stay tuned for that. Thank you all so much. And I have my contact information here if you'd like to get in touch.